Hi, my name is Jelly, and today I'm going to cover the 5 subdomains of medical assessment. That includes physical assessment, medication review, nutrition assessment, bone health assessment, and pain assessment. As a takeaway, I have included here the SPICES tool by Fulmer, and as well as the instrumental activities of daily living scale by Lawton. Let's dive right in. When we are doing a physical assessment, we are going to follow a sequence of how we assess each system. We are going to inspect first, auscultate, percuss, and palpate. This is especially important when it comes to assessing the abdomen area. The reason why we are auscultating first prior to palpation or percussion is that palpation and percussion could alter the bowel sounds, so it may affect the baseline data that we will be obtaining. First, what you wanted to do is to perform hand washing or hand hygiene. Introduce yourself to our patient and identify your patient. Make sure that you have the right one, and you have to explain the procedure to the patient to alleviate the patient's anxiety. And of course, we need to provide privacy to our patient. Good morning, sir. My name is Jelly, and I'll be your nurse for today. Please state your complete name.
Richard Franklin.
Richard Franklin. And how do you want me to call you? Franklin or Richard?
You can call me anything so long as you call me.
Okay. Alright, so Richard, can you tell me your date of birth?
November 28, 57.
That's good. May I look at your armband? Okay, great. Well, Richard, today I'm going to perform a head-to-toe assessment on you. This assessment is very important because it will tell us about your overall condition, and any unusual findings will be noted and will be acted upon. Do you have any questions about the procedure?
No questions at all.
So then the next thing to do is you can ask questions to your patient to assess his neurological status. So, Richard, can you tell me where you're at right now?
Oh, I'm at the clinic.
Okay, well, can you tell me what we're doing here today?
We're doing an overall evaluation.
That's right. And can you tell me who's the president of the Philippines?
Oh, the president of it, Donald Trump. Sorry, not Donald Trump. Oh, Duterte.
That's correct. No, our patient was able to answer all those questions. He was able to tell us his complete name, his date of birth, and also some current events, what we're doing here today. So he's pretty much alert. The next thing that you have to do is to take the patient's vital signs. Another thing that you should assess is the patient's pain rating scale, and as well as the patient's BMI, so we'd have to collect the patient's height and weight. Are you feeling any kind of pain right now?
Yes, actually, I am.
What kind of pain is it?
It's more of a burning sensation from some cream that was applied to my toe. So,
if we rate your pain from 0 to 10, 0 being no pain at all, and 10 as the worst pain you've ever had, how would you rate your pain right now?
About a 6.
I'm going to note it right here. You're feeling about 6 level of pain. I have a separate video for a detailed pain assessment, and it will be shown in this video.
Now what we're going to do is we're going to start with the head and move our way down to the toes. So first, we're going to inspect the head, and we're looking at the skin color. Our patient's skin is nice and pink. We're also going to make sure that the head is the same size as how it should be for the body. And we're looking for any abnormal movements or twitching of the face that he can't control, which are involuntary. So here we don't see anything. And we're making sure that the face is symmetrical. There's no drooping on one side, like in this picture. There's drooping on one side of the face, and this can be seen in Bell's palsy or in stroke patients. And we're also just looking at the eyes and the tip of the ears if they have the same level.
Richard, can you close your eyes tightly for me and then open them up? Now, can you smile, Richard? Can you frown for me? Can you pop out your cheeks? As a general consideration when doing physical assessment, limit the time that our patient is in the supine position since it may cause back pain for patients with osteoarthritis or kyphoscoliosis and even shortness of breath for patients with cardiopulmonary diseases. Having pillows on hand for this kind of patients will be greatly appreciated. For areas requiring special emphasis, as a general observation and when we take vital signs, we have to check and observe for signs of activity of daily living deficits, poor hygiene, and disheveled appearance. Also, we have to check the orthostatic changes in blood pressure and pulse. We have to also record the weight of our patient at each visit to identify possible weight losses and establish a pattern. Another thing is we also have to check for signs of malnutrition and trauma in cases of elder abuse, neglect, or falls. When it comes to skin, we have to check the presence of neoplasms, especially in sun-exposed areas, nipple retraction, and peau d'orange or the orange skin peel. In addition to that, when we conduct the hint examination or the head, ears, eyes, nose, throat examination, we have to check for gross auditory acuity, also an otoscopy to determine the possible reversible causes of hearing loss. Then we have to inspect the mouth after the removal of dentures to assess conditions that may affect nutrition. Also, we have to palpate our patient's temporal artery for tenderness, thickening, or nodularity for patients that are complaining of headaches. When it comes to assessing the neck, we can perform the Dix-Hallpike positional test maneuver to determine the possible presence of benign positional vertigo. Then we also have to assess the jugular venous pulse, which is better observed on the right side. When it comes to assessing the lungs, we have to take note of the age-related changes in the pulmonary physiology and age-associated pulmonary pathology. And another thing that may be present for our elderly patient when assessing the lungs is localized wheezes, which could indicate carcinoma or obstructing bronchial lesion. Then we have the breast exam. Tumors might be easier to palpate because of atrophy, and remember that male might have the possibility of malignancy, so it is best that we also palpate to check. Moving on to assessing the abdomen, for patients who are unable to lie flat, and when we assess their abdomen, they may give the impression of distension. Apart from that, peritoneal signs may be blunted or absent in elderly patients. And also, through palpation, we may assess the urinary retention of our patient or assess for aortic aneurysm. Now, the bladder can also be percussed. When assessing the extremities, it is important that we assess for arthritis, deformities, injuries, podiatric care, and as well as contractures. We need to assess all of that because it could increase the risk of pain, infection, and gait disturbances. When assessing the rectal area, it is important that we assess for diseases of the prostate, fecal impaction, and the integrity of the sacral reflexes for patients with impotence and spinal stenosis. Lastly, when we are doing the pelvic assessment or examination, it is very crucial that we assess for presence of pelvic prolapse, uterine or vaginal neoplasm, and infections. Putting our elderly patient in lithotomy position may be uncomfortable or may produce discomfort. So the alternative is to put our patient in left lateral decubitus position with the right hip flex more than the left. Speculum examination for our elderly patients may be painful due to vaginal stenosis or the atrophic changes.
Gait speed test assesses an individual's functional mobility, and it is also used to assess or evaluate the severity of sarcopenia. Average gait speed of longer than 5 seconds to walk 4 meters is an indication of frailty. Richard, our client, has a gait speed of 3 seconds. The time up and go test assesses mobility, balance, walking ability, and fall risk in older adults. A score of 10 seconds is considered normal, while 20 to 30 seconds indicate impaired mobility. Greater than 30 seconds would indicate problem. The patient can't go outside alone and requires a gait aid. Here, our patient completed the test in 7 seconds. drawing test is a quick screening test for cognitive dysfunction secondary to dementia, delirium, or a range of neurological and psychiatric illnesses. By providing the patient with a piece of paper with a pre-drawn circle, indicate that the circle represents the face of a clock and ask the patient to put in the numbers so that it looks like a clock. Then ask the patient to add arms so that the clock indicates the time 10 minutes after 11. A score of 10 suggests that cognitive impairment is unlikely, less than 8 indicates cognitive impairment, while less than 5 indicates prominent impairment. Here, the patient scored 10.
Hi, Mr. Richard. Thanks for coming in.
Oh, my pleasure.
The focus of our meeting today is to identify all your medications and as well as the possible medical related issues. Plus, we are going to talk about cost savings opportunities. And after the end of our meeting today, I'm going to send you an updated list of your medications. So let's talk a bit about your current medications.
Sure.
I have noted them based on the medications I've filled for you earlier, but I'd like to confirm them if these are all correct or if we are not missing anything, okay? Alright. The conditions that I have noted or identified right here are high blood pressure, high cholesterol. Are these correct? Anything that I've left off?
No, you haven't left. Everything is correct.
Alright. Before we discuss your prescriptions or your medications, can you tell me if you have any allergies to food or medications?
No allergies to food or to the medications.
That sounds good. Do you have any other health issues or concerns?
No, not that I can think at the moment. I'm doing pretty good.
Well, I can see that you are in good shape right now. Well, I've started a list right here of all the medications you feel at our pharmacy.
Yeah.
Let's review and confirm that these are still current, okay?
Sure.
I see that Dr. Randall has you on 150 milligrams of Aprovel for your high blood pressure. Are you still taking this?
Yes, every day, once a day in the morning.
So you're taking it every day and once a day in the morning. Is it after meals or before meal?
I take it after meals.
That's perfect. And that's what my records show right here. And you know, sometimes it can be difficult for patients to remember their medications.
Not for me.
Great. Richard, the Aprovel can sometimes cause you to be feeling dizzy or have a headache. And sometimes it can even cause you to vomit or have a diarrhea and pain in your joints. Are you feeling any of these side effects?
Well, usually the only type of dizziness I feel is sometimes, when you're getting out of bed and there's a little dizziness here. But apart from that, I think I'm doing pretty well.
What I can suggest you to do is to get up from your bed gradually and not so suddenly. Gradually will eliminate or reduce the chances of feeling dizzy, okay? Richard, how's your blood pressure readings since you've been taking or starting Aprovel?
Well, I've not been taking the readings, just the medications.
Oh, I see. Okay, now it is very important that we monitor our blood pressure level, so we might have to educate your family member to monitor your blood pressure regularly. I'm going to have to talk to them later, okay?
I wish you would.
Before we move on to your next medication, Richard, do you have any questions regarding your Aprovel medication?
No questions at all.
Alright, that sounds good. Now that we have been through your prescription medications, I'd like to know did you bring in any over-the-counter medications like vitamins or supplements as well?
I take vitamins like B12, C, and as far as I can recall.
I see. And how often would you say that you are taking them?
I take them once a day at night.
Is it effective for you?
Well, who knows if vitamins are effective? You just take vitamins and hope it's doing something. Nobody knows if it works.
Those are really important ones because our bodies do not produce our own vitamin C's and B complex, so taking supplements as such is very important. So, alright, I'll add that to your medication list right here. Well, I think we have covered or we have gone over everything that I've planned. Do you have any additional questions or concerns that you may have today, Richard?
No questions or concerns.
Great. Thanks so much for coming in. I'll finish up updating your medication list and send it out to you and follow up to our appointment. Like today I mentioned, I'll also consult with your physician regarding your blood pressure readings to see if your approval has been effective on you.
Sure.
Okay. Now, if there will be any changes on your regimen, I may have to contact you. Does that sound okay?
No, that's fine. That's fine.
All right. Thank you so much, Richard.
Oh, my pleasure.
When you're settling into your 60s or heading into your ninth decade, be careful when taking prescription and other over-the-counter medicines, herbal preparations, and supplements. And if you're caring for older loved ones or patients, help them stay safe too. Why the special concern? The older you get, the more likely you are to use additional medicines, which can increase the chance of harmful drug effects, including interactions. And as you age, physical changes can affect the way medicines are handled by your body, leading to potential complications. For instance, your liver and kidneys may not work as well, which affects how a drug breaks down and leaves your body. The 2012 American Geriatric Society updated Beers criteria has been the leading source of information about the safety of prescribing drugs for older people. To help prevent medication side effects and other drug-related problems in older adults, the American Geriatric Society, or AGS, has updated and expanded this important resource. The expanded AGS updated Beers criteria for potentially inappropriate medication use in older adults, identifies medications with risks that may be greater than their benefits for people 65 and older. Healthcare providers should consider avoiding drugs on this list when prescribing for adults 65 or older. These medications pose a higher risk of side effects, may not work as well in an older person, and may be replaced with safer or more effective medications or non-drug remedies.
Good morning, Richard.
Oh, good morning. Good morning, Nurse Jelly.
My name is Jelly, and I'm your nurse today. Have a seat, please.
Yes, thank you. Thank you. Can I have one too?
So, Mr. Richard, how have you been?
I've been doing very good. Cannot complain. I'm doing really well.
Okay, I see that you are as fit as a fiddle right now.
Oh, most definitely. I do try and keep it as a fiddle.
That's good. In today's evaluation, we are going to conduct a mini nutritional assessment. This assessment is very important to evaluate how well you are receiving your nutritional intake and how you are doing.
Sure.
Would that be okay?
No, that's fine.
All right. Richard,
Yes.
has your food intake decreased over the past 3 months, maybe due to the loss of appetite or difficulty chewing, swallowing?
No, not at all.
Oh,
My
that's
appetite has been constant.
all right. I see. Well, have you ever experienced any weight loss, you think, during the last 3 months?
No, not at all.
Okay. Well, I see that you were able to walk into the clinic today, so you have no problems moving around.
No, not at all.
Have you been driving, and how is it?
Yes, I've been driving. I have no problems at all.
Okay, that's cool. Richard, have you suffered from any psychological stress recently? Feeling of sadness, depression, you know?
No, not at all, except, being in a strange country and adapting to the different cultural activities, perceptions, and things of that nature.
I see. Yeah, I totally understand that it is quite a challenge adjusting to a new environment or new country. So Richard, how are you coping with your new environment? Like, let's say staying here in the Philippines.
Well, I'm coping very well. I've adapted to it, so that's fine.
And what are your strategies in adjusting yourself?
The strategies are just be oblivious to certain things and ignore it, and just deal with it and just put up with it.
I see that. Richard, we're gonna have to measure your height and your weight so we can check your body mass index. Checking your body mass index will tell us too if you are receiving your proper nutrition, okay? Now that we have gotten your height and your weight, I'm gonna have to ask you if Do you live independently, or are you living here with some family members, perhaps?
Yeah, I live with a family.
Okay. Do you take more than 3 prescriptions per day?
No, just 3 prescriptions.
3 prescriptions, and that's what I have here on my record as well. Just trying to verify it. Do you have any pressure sores, maybe, or skin ulcers?
No ulcers.
Okay, that's great. How many full meals do you take every day?
Three meals: breakfast, lunch, and dinner.
Okay. And can you tell me about your selected consumption for your protein intake, perhaps? What type of protein do you usually take?
Well, mainly my protein comes from meat, like chicken and beans.
Chicken, beans. Oh, I love beans. Okay. Well, do you eat meat every day?
No, I eat chicken every day. I eat fish and sometimes beans.
Okay, I see. Do you consume 2 or more servings of fruits or vegetables per day?
Yeah, I would say so.
Alright, that's really good. And how much fluid do you consume every day, approximately?
That's a hard one. I would say
Like less than 3 cups, 3 to 5 cups?
maybe 4 or 5 cups.
4 or 5 cups. And you're able to feed on your own, right? You could eat on your own. You don't need any assistance, correct?
No, I can feed myself.
Alright, good. And how do you view your own nutrition? Do you think you are undernourished, overnourished, or
I am nourished.
nourished? Okay. Well, in comparison of like other people of your age, how would you consider your health status? How would you consider your health
I
status?
consider, except for the few ailments, very good.
Okay. Thank you, Mr. Richard.
Here is a body mass index calculator. It's a free application for calculating your body mass index and tracking your weight. You can set your weight goal, keep a diary of your weight and BMI progress over time, and see automatically generated graphs and charts based on your diary entries and weight goal. The application shows that the BMI of our patient is 26.85 and it is indicated as overweight. There is a difference of 5.61 kilograms from his normal body mass index.
Hello, Richard. It's me again, Jelly. I'll be your nurse for today. How are you feeling today?
Oh, good afternoon, nurse. I am feeling very, very good today.
I'm happy to hear that. So, by the way, Richard, the purpose of my visit for today is that I'm going to ask you questions to get an overall information about your bone health status. Would that be okay?
Well, that's quite all right.
All right. Well, Richard, I would like to know have you had any bone fracture in the past 6 months?
No fractures at all.
Oh, Richard, have you had any bony pains in the past, or anything with your joints?
Yes, I've had pains in my knee whenever I jog, or if I kneel for some time, then I have pains, yes.
Oh, so you're saying that every time you jog, it puts an excessive pressure on your joints, and what kind of pain do you feel? Is it like stabbing? Is it,
No, it's more like a radiating pain, around my knees.
Okay, well, I'm going to note that right here so your physician can check your knees if, we can do anything to improve that. Well, how about, have you noticed any loss of weight for the past 6 months?
No, not at all. I don't usually weigh myself, so it's not easy to tell.
Okay, well, have you heard of anybody telling that you have lost a lot of weight, perhaps?
Yeah, I've heard a few comments, but it could be due to my diet. I'm a very healthy eater, and so it could be that that's due to my diet.
Okay. Well, you mentioned about your diet. Can you tell me or describe to me, perhaps, your usual diet?
Sure. My diet usually consists of maybe grilled chicken or fish, okras, cauliflower, broccoli, things like that.
Okay. Do you consume a lot of dairy products like cheese, yogurt, milk?
No, not at all.
Not at all. I see. Okay. Richard, when was the last time that you had milk, cheese, or any dairy products?
Well, actually, I must say I do have some dairy products in my popcorn, my nightly popcorn, where it's really Parmesan cheese. So, yeah, that's what I mainly have for dairy.
Okay, I see. Well, some vegetables actually contain, calcium, such as cauliflower and a lot of other green stuff, green vegetables.
Right.
So, in fact, that taking a lot of food or food that are rich in calcium is very important to keep our bones strong and healthy. Richard, you said that you eat fish, chicken. What type of fish mainly do you consume?
Mainly tuna. And I don't know the names of the other fishes.
Tuna is very good because it's rich in omega-3 and also it has some calcium in there. Actually, some fish that are rich in calcium would be mackerel and salmon, those type of fishes would be very good source of calcium. Well, may I know, Richard, do you drink alcohol?
Yes. Every night I have a couple fingers.
A couple fingers, and how many ml or cups is
Well,
it?
when I say a couple fingers, I fill the glass 2 fingers up and stop. So yes, I usually like to have some rum.
Oh, rum. Okay,
Yes.
I see. And that's every night, right?
Yes, every night. More or less every night.
Okay. Do you smoke or any history of smoking?
No smoking at all. Except when I'm burning leaves.
Okay. Richard, when it comes to your level of exercise, how often do you exercise?
I haven't been getting much exercise recently, but I do, get some minor exercise from walking and taking care of plants and animals, bending down, weeding, things like that.
Oh, okay. So you were farming, basically gardening, like that.
Gardening, yes, gardening.
Okay. Well, that's good. And how many hours do you spend gardening?
Well, it varies from day to day, but let's give it an average. Let's say maybe 45 minutes.
45 minutes,
Yes.
and how often that is?
That's on a daily basis, but like I said, that's an average.
Okay. Can you tell me from what time to, what time do you
Well,
spend gardening?
sure. Usually it's in early morning, prior to the sun coming up,
Yeah.
and then in the afternoon when it gets cool.
Okay, so twice a day, basically.
Well, like I said, it's an average, yeah.
All right. So before the sunlight comes up and before it gets too hot.
You're correct.
Okay. Well, that's very good because, we need at least 15 to 25 minutes of sun exposure to get all that vitamin D from the sun. Vitamin D will help us to regulate the calcium levels of our blood, and deficiency with vitamin D can cause aches and body pains like that. So it's awesome. Do you have any family history of like bone fracture, osteoporosis perhaps? Your mom or your dad?
Yeah, my mother had. That's the only person in the family.
Okay. Well, because your mom, did she have it, when she was like younger or
No, in her
older?
later years.
Okay. Another thing that I'd like to ask you is, do you have any history of using glucocorticoids kind of medicine?
No, not at all.
All right. That's it pretty much, Richard, for today. And do you have any questions?
No question.
I will communicate this information to your doctor, and if anything, we'll get back to you, okay?
Sure.
All right. Thank you so much, Richard, for your time.
No problem. I'm sure Dr. Philip and his nurse Nika will be glad to hear from you.
I'm sure. I think they will be doing their rounds later
Yes.
today, so they'll be seeing you.
Oh, yes. I can bank on it.
We have right here the FRAX tool, or the Fracture Risk Assessment tool. This algorithm gives the 10-year probability of fracture. Administration time is about 10 minutes. It's very user friendly. It can be administered by the general physician or the nurse or the patient himself. This was created by the World Health Organization in collaboration with the Center for Metabolic Bone Diseases in UK.
Good morning, Mr. Richard. My name is Jelly, and I'll be your nurse for today. How are you feeling? Do you have any kind of pain?
Well, at present, I'm feeling really good, but the pain comes with certain activities.
Oh, okay. Well, what particular pain are you feeling? Which particular part of your body?
Basically in my knees.
I see. Okay. Well, is there anything that makes the pain better or make it worse?
Yes, if you do not do certain activities, then there is no pain, and if I do certain activities, then there's a lot of pain. For instance, major pain comes when I jog. If I jog, the pain starts, and if I stop right then and there, then the pain subsides quickly. However, if I say overdo it, then the pain becomes excruciating, and I just have to stop, and I'm immobilized for a certain amount of time till the pain goes away. That's why I do not jog anymore, because at some point, it used to take a long time for the pain to go away, maybe a day or so. So now that I do not jog, there's no pain. However, in just ordinary day-to-day activities, for instance, kneeling to do weeding, it seems like it's putting pressure on the knees, and that causes pain. Also, little things like kneeling to look under the bed, that's another issue. Or even sometimes just stepping up on the bed, the air conditioner is above the bed, step up there to reach it. That too is a problem that creates pain.
I'm sorry to hear about you not being able to jog anymore because of the pain that it triggers.
Well, I should have stopped jogging a long time ago, because doctors tell you anyway that it's better to walk than to jog. Because jogging after a while, from what I understand, can ruin your knees. I've had a friend in the past, that's what happened to him, the pounding of the knees on the pavement, and his knees gave out on him. So, maybe this is a blessing in disguise. I mean, it's not as bad as some other people, but, it's bad nonetheless.
Right, I agree. Well, how would you describe the pain that you have on your knees? Is it some kind of a throbbing pain, aching pain, burning, stabbing?
I can't, at this time, I can't really describe it. I just know it's an excruciating pain in my knees that tends to immobilize me. It doesn't burn and it doesn't throb. It's just a steady pain.
Okay, I'm going to note that right here. Does the pain radiate in any part of your body, or does it stay in that site?
Yeah, it's localized in that area.
Okay, so it's a localized pain. Well, how would you rate your pain on a scale of 0 to 10, 0 being no pain at all, and 10 being the most painful?
Well, if I'm jogging, for instance, and the pain comes, then it's really 8 plus. And yes, and then I'd have to stop and let the pain subside, and just hobble along until my knees recuperate.
Okay, so does the pain go away after a few days, or?
No, it will go away sometime after that if I stop. If I feel it's coming on, and I stop, it tends to dissipate quicker that way. But if I continue to run, then it really gets worse and takes a longer time to dissipate. So I do not I do not jog anymore because of that pain. However, in day-to-day activities like, say, doing gardening and you're kneeling on, or say you're bending down to look under the bed, it's also problematical too because there's some pain. Maybe not excruciating, but enough to make you stop.
I see. Okay. I'm gonna let your doctor know about your pain and see if I can get you some medication for your pain, and hopefully that will make you feel a little better after a while. So, do you need anything else from me?
No,
right now?
no, not at all, not at all.
Good morning, Richard. My name is Jelly, and nice to see you again. I'll be your nurse for today.
Oh, very nice, and welcome.
How are you feeling today, Richard?
Oh, I'm feeling very good.
Yeah. And I can see that. Richard, today I'll be asking you a few questions. That way we could make your stay here a little bit more comfortable. And the tool that I'll be using is called Spices tool. This tool will allow us to get a little bit of an idea of how to plan for your care. Would that be okay?
Oh, that's fine.
The first question that I'm going to be asking you is about your sleeping habits. Do you have any difficulty with sleeping or trouble like that?
Well, actually, I have not had it actually diagnosed, but sometimes during the day I'm a bit fatigued, etc. But I think that I might have sleep apnea, but I've not had it diagnosed.
Okay, well, I'm definitely going to note it for here so your physician can run a check on you and verify that one, okay? Alright, so Richard, how many hours do you sleep at night usually?
Well, let's see, it's a good question. I go to bed at say 9 o'clock.
Yeah?
And usually I'm up by 5 o'clock. But in between those hours, I find myself awake maybe 4 or 5 times. So, in all honesty, I cannot tell you how much sleep I get. And that's why, sometimes during the day I feel a bit fatigued.
I see. You mentioned that you are often awake in between those hours. And what's causing that one? Like, what triggers that?
Well, I don't know. Like I said, I might have sleep apnea.
I see.
I should get it checked out at least to see if that's the problem.
Okay, well, have you been sleeping well here in the hospital?
Yes and no. I actually, it's really hard to say something because usually when I'm not in my own bed or my own place, it's kind of difficult for me to sleep. Especially here in the hospital, especially when you are in bed constantly, you tend to be well rested and all that. So, that's part of the problem.
Okay, well, I will note that right here as well. And I understand that staying in the hospital is quite boring, that you just have to, all you do is like lay down in bed.
Exactly.
Yeah, and but anyway, Richard, just imagine that you're on a vacation and you're resting. Alright. Richard, after this meeting with you, right here, I'm going to be meeting with the geriatric team that includes the doctor and the geriatric nurse practitioner, and we're going to see if we can do something about your sleep regimen to make it, make your sleep a lot better, okay? The next question that I'll be asking you, Richard, is that I'd like to know in terms of like food preparation, do you have any problems or difficulty cutting off the food or feeding yourself like that?
No, I have no problems. I'm quite capable of doing that myself.
Okay, so you don't need any assistance at all.
No, no, not at all. But if someone wants to assist, by all means, please do.
Well, do you have any pain or trouble swallowing your food?
No, no, not at all.
Do you prefer food of softer consistency?
Well, if you mean ice cream, sure. You know, at first I love ice cream. However, I can take hard food.
Oh, you can. Okay. Do you have a dentures, perhaps?
Yes, I do. So when I eat, I use my dentures and hope, I had this incident once where I bit into the meat and the dentures got stuck in there. Yes, and the nurses had to come and try and get the meat, and the dentures came out. And it was such a mess with the dentures.
Okay, I see.
Yeah.
Well, I'd rather find that entertaining, Richard. But your record shows here that you have not been wearing dentures. So you mean your denture is new?
Yes, well, I recently started to wear dentures.
Okay, all right. My next question, Richard, will be about urinating and bowel movements. Okay?
Yeah, my favorite topics.
Do you have control of your bladder and your bowel movement?
Yes, I do have control.
So when you get the urge or when you have the urge to urinate like that, do you go immediately to the bathroom or do you wait for a little bit or a little while?
Well, it depends. I mean, there's some instances, depending on where you are, you cannot go at that moment, so you just have to wait. And other times, if I'm in a position to go at that moment, then I will go.
Okay, so that means that you are well able to hold your urinating urge, right?
Yes.
Okay, good. Richard, I'd like to know how often do you urinate? Is it like every hour, every 2 hours? I know that this is like a difficult question.
Yes, it's very. I've never, and it varies too. I mean, I've gone for hours without urinating, and then at night, I think 2, 3 times. Other times, let's see, maybe let's say if I say I was 3. Maybe maybe 6 times. I don't know.
So maybe we can set up a toileting regimen for you, so to make it easier. Do you need a bedside commode perhaps right here, so you won't have to walk all the way to the bathroom?
Oh no, not at all. I definitely prefer to walk to the bathroom.
I understand. Okay. Well, Richard, do you need like assistance to go to the bathroom or anything like that?
No. I can handle that myself.
All right. If you ever need any assistance in going to the bathroom, please don't hesitate to call us or any of the staff right here, okay? We'll be glad to assist you.
Oh, thank you.
Okay, well, what about when it comes to bowels? Do you have control over your bowels?
Oh, yes, very much so. I have control, except if I have diarrhea. Then, of course, you have no control at all. Yes.
Right.
Yeah.
Now, Richard, when was the last time that you went to the bathroom?
I went to the bathroom a few hours ago.
A few hours ago,
Yes.
all right. Okay, well, Richard, were there any periods, of your stay here in the hospital that you felt confused at all? Sometimes when we are feeling uncomfortable or like especially pain, we usually feel confused and don't, mind whatever is going on around us, right?
Well, yeah, I mean, one night, and I guess it's because I'm not familiar with the room. I got up to urinate to go to the bathroom, but I thought I was at home. And so I went the usual way
Yeah?
from my bedroom, and not realizing it, I peed on another person.
What?
Because I didn't know that, I had just forgotten, I was disoriented at the time, but it was a wonderful chap. He understood, and so.
No, you mean you peed on another person's restroom?
No, another person. Because I was disoriented, I thought I was at my house. And you get up at night, you're groggy, and so you go this way to, And so I thought I was, at home going to the bathroom, my bathroom, and So,
Oh, I see, okay.
Right, so that's the only time I, was disoriented, just at night.
Alright.
I was so embarrassed about it, but the chap, he laughed it off.
Okay, I see. Well, I'll definitely have to note that right here, and we'll see if we can do something about that. Now, Richard, the next question is, have you ever fallen in the past 6 months?
Well, falling, I tripped once,
Mm-hmm.
and fell, but no, I've not fallen, except for that incident where I tripped and fell.
I see. Do you need any assistive devices to move around?
No, I'm quite capable of moving.
Okay, I see. So no walker, no nothing like that. And when it comes to transferring from one place to another, you don't have any issues with that either, right?
No, not at all.
Okay, good. Richard, do you have any skin problems at all?
Well, I've seen this white spot here on my skin here, and I just write it off to getting up in age where you see elderly people with these things. So
Well, when did you start observing, this white spot to be appearing?
It's been a few years now.
I see, okay. Well, did you use anything at all like that to get rid of it, or?
Well, I'm a person that believes in hydrogen peroxide. So, no matter what I have, I always use hydrogen peroxide. So, I tried peroxide, and it didn't work at all. So, I just left it.
Okay, so have you ever consulted a physician before about that?
No, because it's not painful. I don't see any reason to, for something, a little small thing like that.
Now, Richard, I see over there you do have a scar. What happened to that one?
A scar?
Yeah, right here. Right there.
No, that's just a little scratch, nothing to write home about.
Okay, so nothing major.
No.
Well, how often do you put lotion?
Well, no, I don't use lotion. I used to a few years ago, but I don't use lotion now. No, I don't use lotion at all.
The Philippines is a very hot and warm country, and keeping your skin moisturized, Richard, is very important. Okay, so your skin won't dry up, and if our skin is drying up, you'll feel a lot of skin problems like that. So you might want to start applying moisturizer. Okay. I'd like to check on your skin because checking your skin regularly or frequently is very important. So we would prevent future problems. It's part of skin assessment.
Sure.
Would that be all right?
That's fine.
Okay. So now that we have checked your bony prominences, your skin is intact, I think that it's all good. We have to constantly monitor that because there may be change in color, temperature, and appearance. So we have to prevent the ulcers from, happening. We don't want that. And that's why we have to always assess the integrity of your skin. So Richard, I think I have covered everything that I need to check with you today. I'm going to talk to the interdisciplinary team and let them know about your condition and what I have assessed today, and hopefully we could plan a better care for you. Richard, do you have any specific goal that you wanted to achieve today?
Golly gee, to get out of the hospital. I mean, that's my goal.
Alright, well, we'll be doing our best to help you with your goal of getting out as quickly as you can. And Richard, I appreciate your time. Thank you very much, and I'll see you again next time.
Sure.
Good morning, Richard. My name is Jelly, and I'll be your nurse today. How are you doing?
Oh, I'm doing quite well. Thank you very much. I've been expecting you.
Richard, today I have such a very good news for you, because today is your schedule of discharge. How do you feel about that?
Yes, I've been anticipating that since yesterday afternoon when I spoke to the doctor. So, I'm eagerly awaiting the discharge papers.
And I've seen that for the past few weeks you have been doing really well in your recovery. And for today's discussion or meeting, Richard, I'm going to ask you questions about your activities of daily living so I can bring them up to the interdisciplinary team and we could make sure that we have the best discharge in place for you. Would that be okay?
That's fine. That's fine.
Today I noticed that you were able to shower completely unassisted, and so how do you feel about that? How's your back?
Oh, my back is good. I've had no recent problems with it, and I think the only thing I had with the shower is when I turned the faucet and the handle flew off in there and the water went everywhere and the soap fell and then I almost slid and hit myself. But apart from that, it was very good. I did it all by myself.
Oh, you have.
Yes.
I'm really sorry to hear about that, Richard. I see that our technicians are already on it, and I do apologize for the inconvenience.
Oh, yes, no problem.
Our clinic,
no problem. Yes.
our hospital needs updating, Richard. So, anyway, we will make sure that that won't happen again in the future. Okay?
Yes, very good.
And I'm happy that you're safe and that you did not slide off earlier. So, anyway, Richard, I would like to know if in your house, do you have a telephone? Like
Yes. It's one of the modern conveniences that you can't live without. So I do have a telephone. I make calls, receive calls. So yes, I enjoy a good conversation over the telephone. So yes, of course.
Okay. And whenever you make doctor's appointment, do you have to use a phone?
Yes, I use a phone and make my appointments. I do use a telephone on a regular basis.
I see. Okay, well, the next question, Richard, would be about shopping, your shopping activities. Can you tell me how do you get to the supermarket or to the shopping mall, perhaps?
Well, usually I go shopping maybe every 2 weeks, and usually I just take a taxi cab and go to the supermarket, and then I will catch a cab back.
I see, okay. Well, how do you shop for large items such as sheets, big clothes, towels?
Well, those are things that I already have. I have enough towels, I have enough sheets. I don't really. Now, those are things you shop for once in a blue moon. So I have all those things, so that's no problem. I usually just go and shop for food. And, I have a deep freeze, so I get enough and I stock up.
You stock up, okay, so you buy in bulk.
Indeed, I buy in bulk.
Okay, I see. Well, are you able to carry the bulk groceries?
That's
or
why I get a taxi.
do you need assistance to transfer your groceries from the,
Well,
car
usually
to...
at the supermarket, one of the gentlemen there will help me load up. And then, of course, usually, I just give the taxi driver a little extra and he helps bring the groceries in.
That sounds really wonderful of that gentleman. Yes. Okay, well, Richard, the next question that I'll be asking you is about your food preferences and all that stuff. So what types of food do you like to cook and eat?
Well, usually I love beef, all forms of beef. I like to grill beef, roast beef, beef stew, and so I make different type of beef steak, I love to enjoy a nice T-bone steak or porterhouse steak. So, I eat quite a bit of that. I supplement it, of course, sometimes with fish, especially salmon and cod. And also sometimes I have chicken. So, yeah, it's pretty rounded as far as the meats are concerned. Yes, I have my favorites, but I also indulge myself in other type of meats as well, meats and fishes. I'm a meat eater.
Yeah, okay. Same here, Richard. I do love fish as well and other meat, but we have to try to balance it out with some veggies, okay? Now, Richard, do you ever cook with or using stove, perhaps?
Yes, everything is usually cooked on a stove, except when I'm doing a barbecue, then I have a grill outside and I use to cook on.
Okay, that's great. Well, what about, do you have anybody in the house helping you with the chores, such as cleaning, vacuuming?
Yes. I do not really do the cooking indoors. I mean, I'll grill out there, but I have a housekeeper and she takes care of the cooking.
Sounds perfect.
Yes.
Okay, well, what about the laundry? Does your housekeeper do that too?
Yes, all the housework, the cleaning and all that, she takes care of. And then I have a gardener who takes care of the garden and all that outside, yes.
Well, do you have your own washer and dryer?
Yes, I have a washer and dryer and the person uses it.
Okay, well, do you drive your own car, Richard?
No, I have a chauffeur. And because at present, you get stressed out driving because of traffic and the rules and regulations. So I usually have the gardener acts as a gardener / chauffeur. And sometimes when he's busy, I allow him to do things, often I'll just take a taxi.
I see. Okay. So how are you getting home upon your discharge today?
Oh, I made arrangement and John will be picking me up.
John? Who is John? Is he your family member or something?
Well, John is a friend. We play cards every Wednesday night. And it's been a little while since we played cards, so he's eager to pick me up.
Oh, I see. Okay. Well, what about, Richard, when it comes to your medicines? Do you take it by yourself or do you need somebody's assistance?
No. Well, I could take it by myself, but Mrs. Gonzalez, the housekeeper, is wonderful. She has everything streamlined and, she knows what is needed and she has it prepared for me.
Oh, you are such a lucky person to have, somebody to assist you, right? It's really good. So, Richard, do you pay your own bills, write your checks, go to the bank, or do you need somebody's help to do that?
I could do that, but, it's such time consuming and boring that oftentimes, I just have Mrs. Gunn. She's such a wonderful person. I have her. She'll take the car and she will go and pay the bills and all that. I just cannot take standing in line and waiting to pay bills and all that. So Mrs. Gonzalez, she does that for me. Wonderful lady.
I certainly understand that, and I don't like waiting as well and standing up in the queue, Alright, Richard, I think I have covered pretty much everything that I have planned for this meeting. Do you have any questions for me or any concerns, perhaps?
No questions or concerns. Everything here has been pretty much straightforward.
Okay. Well, as I've said earlier, I'm going to tell the interdisciplinary team about your activities of daily living, and I think that there seems to be no problem here. And as I see it from here, it will be most likely that you'll be discharged today. So, All right, well, it's happy working with you today, Richard. Have a
Good.
great day.
Good, thank you very much, and you as well.